Hello, dear viewers. Today, I want to talk about both a recent news story and a serious illness. The spiritual leader of Catholics and the head of the Vatican, Pope Francis, has been diagnosed with bilateral pneumonia. The 88-year-old Pope is currently receiving treatment at the Gemelli Hospital in Rome, and doctors are closely monitoring his condition. This news is, of course, concerning, but it also reminds us once again how serious pneumonia can be. So, what exactly is bilateral pneumonia, who is at risk, and how is it treated? Let's take a closer look. What is bilateral pneumonia? Pneumonia, commonly known as lung infection, occurs when the lung tissue becomes inflamed. Normally, when we breathe in, air enters our lungs and allows oxygen to pass into the bloodstream. However, in pneumonia, the tiny air sacs in the lungs, known as alveoli, become filled with fluid and pus. This significantly impairs breathing. If the infection affects only one lung, it is called unilateral pneumonia. But if both lungs are affected, it is known as bilateral pneumonia. Since bilateral pneumonia impacts breathing more severely, it is usually more serious and often requires hospitalization. What are the symptoms? Pneumonia symptoms are usually noticeable, but in some cases, they may be difficult to detect. Most common symptoms include high fever chills and shivering cough, which may produce mucus or be dry, shortness of breath and a feeling of tightness in the chest, confusion or altered mental state, especially in elderly patients, fatigue and weakness muscle, aches and joint stiffness. Who is at risk for pneumonia? Pneumonia can occur at any age, but some people are at higher risk. Older adults, 65 and older. The immune system weakens with age, making infections more dangerous. People with weakened immune systems, those undergoing chemotherapy, organ transplant recipients, or individuals taking immunosuppressive drugs, such as corticosteroids, are more vulnerable. People with chronic diseases, individuals with COPD, asthma, diabetes, or heart disease may experience more severe pneumonia. Smokers and heavy drinkers. Smoking damages the lungs, while excessive alcohol consumption weakens the immune system. Young children under 5 years old, their immune systems are not fully developed, making them more susceptible. How is pneumonia treated? Pneumonia treatment depends on its cause and severity. Bacterial pneumonia, treated with antibiotics. Patients typically feel better within a few days, but stopping treatment too early can lead to a relapse. Viral pneumonia, treated with antiviral medications and supportive care, such as rest, fluids, and fever reducers. Supportive treatments, oxygen therapy for fluids, and respiratory support may be required for severe cases that need hospitalization. Early diagnosis is crucial to preventing complications. If you experience symptoms like a persistent cough, difficulty breathing, or a high fever, you should see a doctor immediately. How to prevent pneumonia? The most effective way to prevent pneumonia is through vaccination. Those in higher risk groups should get the pneumonia vaccine and the flu shot. Additionally, you can protect yourself by washing your hands frequently, reducing or quitting smoking and alcohol consumption, maintaining a balanced diet, and getting enough sleep, wearing a mask in crowded place. Preventing illness is always better than treating it. Stay healthy and take care of yourself. Also, don't forget to support us by subscribing, liking, sharing, and leaving a comment.